Hey everybody, Nick Espinosa, your chief security fanatic here, and today we actually have to talk about Amazon because Amazon's new virtual health clinic is already a privacy concern. Here's what's going on, and quite frankly, I don't know why anybody would be using Amazon for this, convenience aside. Now, here's what's up. On November 15th of last year, Amazon announced the introduction of a medical service called Amazon Clinics in 32 states that will provide virtual healthcare for more than 30 common health conditions such as allergies, acne, or hair loss. Now, providers will be diagnosing and treating patients on their smartphones via texting. Now, the company is working on absorbing One Medical. It's a human-centered and technology-powered provider of primary care. Quote, One Medical members benefit from a dedicated relationship with their provider, a friendly and convenient in-office experience, and ongoing engagement via a dedicated app. That's according to Amazon's website. Now, the Amazon Clinic follows the opening of Amazon Pharmacy, where patients can get their medication delivered to their door rather quickly in just 2 days for Prime members, if not sooner. Such innovations in healthcare now are raising concerns, obviously, about patient privacy due to HIPAA compliance. So Andrew Tomlinson, Director of Regulatory Affairs at the American Health Information Management Association, noted that HIPAA focuses on the provider, not the technology solution. HIPAA states that providers are considered covered entities if they, quote, transmit any information in an electronic form in connection with a transaction for which HHS has adopted a standard, end quote. And so here's how this works. If you're going to use Amazon Clinic, text-based medicine basically is going to make this stuff more convenient and accessible, and anybody can get a quick interaction with a clinician for a common health concern, according to Amazon. The Amazon Clinic is basically a message-based virtual care service that connects patients with virtual care options when and how they need it. Patients are allowed to choose their preferred provider from a list of reportedly licensed and qualified telehealth providers. Next, they then complete a short questionnaire. Patients and clinicians then connect directly via a secure message-based portal, giving them the flexibility to message their clinician anytime, anywhere. After the message-based consultation, a clinician sends a personalized treatment plan via the portal, including any necessary prescriptions, to your preferred pharmacy. Now, whether a patient interacts with an Amazon Clinic via phone, tablet, or computer, Amazon Clinic has stated that it is a HIPAA-covered entity, and that, again, is according to Mr. Tomlinson. But how Amazon decides to manipulate and exploit the data may not become apparent for many years. Other concerns include the extent to which the data is collected through Amazon Clinic and how it will be used company-wide, meaning Amazon-wide. This data is highly valuable to the company's retail arm, and that's the concern. Amazon has a history, and there are court cases both here and in India, and I think other places, where Amazon has taken internal information and telemetry from their sellers and basically data mining all of us as we're buying stuff in order to turn that into lucrative advertising dollars. And so if you're using Amazon Health Clinic and let's say you've got, acne, which was one of the ones that they covered, guess what's going to start happening? You're going to start getting advertisements for acne creams and face creams and pills and all that kind of stuff because they're simply going to put that into that portal. Now, that said, is their advertising platform a covered HIPAA entity? Probably not. It's going to be a different division. They should not be able to share that information with that advertising division. But if history has shown us anything, these things happen at big tech, and they happen frequently. And essentially what they get is a slap on the wrist. And so they pay the fine and they keep on going. So we're going to see where this goes. I think this is a huge problem that we're going to see. And if this ends up, indeed being a problem at this level, and I do think it will be, then we're going to have issues for years to come with Amazon. So I'm not going to use Amazon Clinic. I don't think anybody should use Amazon Clinic, but obviously everybody's going to make their own choices. And everybody that's not listening to me or understanding really the privacy or cybersecurity ramifications of using Amazon for anything will probably just keep on doing what they're doing, which is to use Amazon. So there you go, and that is your news of the day. And please like, share, follow me here on Facebook and Twitter at NickAESP. And please feel free to subscribe to me at YouTube as well. I can't speak today. And as always, stay safe, stay online, and please attempt to stay private. Thanks, everybody.